everybody. In this lesson, we are going to be talking about diarrhea in the pediatric patient. I know you already know a lot about this symptom and how it affects a patient's fluid and electrolytes. So really, in this lesson, I'm just going to be highlighting the things that are different and noteworthy for kids. So diarrhea is actually a really common cause of admission in our pediatric patients. And the reason for this is because kids are at an increased risk for dehydration, and we talk all about that in the dehydration lesson. And because of this, they end up needing to come into hospital for fluids and monitoring. Now, the most common causes of diarrhea that we see in kids are actually just easily divided into two categories, and those are acute causes and chronic causes. Now, our acute causes of diarrhea are almost always going to be infectious, and an example of this is rotavirus. Rotavirus used to be a huge cause of admission, but actually there's a vaccine for it now, so we're seeing a lot less admissions for it, which is great. Other infectious causes that you may see might be bacterial, so something like salmonella from food poisoning. Now, the chronic causes of diarrhea actually usually end up being due to issues with absorption and inflammation in the bowels. And examples of this would be diagnoses like Crohn's disease, celiac disease, and even food allergies. So our nursing assessment of a patient that has diarrhea really just kind of starts with thinking about what could be causing this. And a couple of things you want to consider when you're chatting with the families are things like recent travel or a change in diet. It's really common to see kids have changes in their bowel habits when parents start adding in solid foods or changing things with a diet. And again, this could be from a food allergy or even something more serious like a celiac disease where the child's having a reaction to gluten. Next, you want to know a lot more information about the characteristic of their bowel movements. So it's really important to ask a lot of questions and find out how often they're having the diarrhea and then what the stool actually looks like. You can see in this photo over here, we have the Bristol stool chart. And this is a really helpful tool to use when you're talking to families about what's actually happening when their child is going to the bathroom. And a couple of things to pay really close attention to are obviously going to be frequency. We need to know how often they're going, but also we need to know if there's blood or mucus in the stool. And blood in the stool tends to be associated with infectious causes, or they can also happen in inflammatory bowel disease. Mucus and like a really foul smelling stool is usually associated with malabsorption. And also remember, it's probably a really good idea to get a stool sample so it can be tested for specific causes. And along with all of that, you've really got to be paying close attention to those fluid and electrolytes. And like I said, these are the two most common reasons for admission, so make sure you're paying attention. And the most likely issues to see are dehydration, hypokalemia or low potassium, and metabolic acidosis. We have full lessons dedicated to talking about these topics, so look for that lesson on pediatric dehydration. And then we also have lessons on ABGs and metabolic acidosis, so look for those if you're not sure what to be assessing for. So when we think about management, we're really going to divide that into the two categories that we talked about earlier. We're going to talk about managing acute diarrhea, and then we're also going to talk about managing chronic diarrhea. So with acute diarrhea, it's going to depend a little bit on what's causing it, but generally our primary goal is going to be rehydrating that patient. So we want to make sure that we're giving them fluids. And then the next thing we're doing, again, is looking for those electrolyte abnormalities and treating those as well. Now, there's a lot of talk about what we should actually do for a child's diet when they're having these issues of diarrhea or vomiting. And what used to be recommended is that kids be on this diet called the BRAT diet. And on this diet, kids are eating bananas, rice, applesauce, and toast. Now, this diet is no longer recommended. And the reason for that is it just doesn't have enough nutrients and proteins and things to actually help the child recover. What we actually recommend now is that kids just go back to eating their regular diet in small amounts as soon as they possibly can. So don't rush it and force big meals, but just start eating their usual foods in small amounts. One important thing to know in cases of acute diarrhea is that we don't use anti-motility drugs in children. There are a lot of side effects that can occur with them, so we try to avoid using those drugs if at all possible. And then remember, most of the causes of acute diarrhea are going to be really contagious, so make sure we're reminding parents of that and encouraging really good hand hygiene. Now, our treatment for chronic diarrhea is really all about identifying and treating the specific cause. And from a nursing point of view, what we really have to do is pay really close attention to their weight, their growth, and their nutritional status. Remember, over time, these children are losing a lot of nutrients through those frequent bowel movements. So we have to pay close attention to all of these things to make sure that it's not affecting them too much. Your priority nursing concepts for a pediatric patient with diarrhea are gastrointestinal and liver metabolism, fluid and electrolyte balance, and elimination. Okay, so let's just do a quick recap and go over your major takeaway points for this lesson. So really, your starting point when you think about diarrhea in the pediatric population is knowing there are two categories. You've got acute causes and chronic. Acute diarrhea is going to be what you see the most often, and it's usually caused by a viral infection, something like rotavirus. And because of this, hand hygiene is super important, and contact precautions are going to be in place in the hospital. Chronic diarrhea is usually a problem of absorption or inflammation, and because of this, we have to pay really close attention to their nutritional status and the weight of these children. Our top two nursing issues for patients with diarrhea are going to be dehydration and electrolyte imbalances. So most of our management is going to be all about treating these two issues. When we're rehydrating patients, it's either going to be through oral rehydration or IV fluids. And then the electrolyte imbalances that you want to be most looking out for are hypokalemia and metabolic acidosis. All right, that's it for our lesson on diarrhea in the pediatric patient. Make sure you go check out all of the resources that we have attached to this lesson. And now go out and be your best self today. And as always, guys, happy nursing.